Ladies and gentlemen, good morning. Let me start by welcoming you back to our YouTube channel, whereby, as usual, we always give you educational bangers. And I always start by appreciating you people for the support you are giving me, because it's only because of you that this channel is where it is at this moment. As I said yesterday, I've been away for some time, but now I'm back. For those who had given up their topics to be discussed, just be ready, because I'll make sure I'll cover all the topics that you people had given me. Yesterday we started a topic about kidney failure. We defined what kidney failure is, the causes, those who are prone to kidney failure, and we started a subtopic about the types of kidney failure. And before we continue, if you are there and you are watching this video for the first time, or you are watching this channel for the first time, just take a second or two and click the subscription button, so that whenever I upload any video, bearing in mind that after subscribing you'll hit the notification bell, or put the notification bell on, you will never miss any of our videos. So let's continue with our discussion, whereby the third type of kidney failure is what we call chronic prerenal kidney failure. Chronic prerenal kidney failure. How does this come about? This is as a result of not having enough blood flowing to your kidneys for an extended period of time. Poor blood supply to your kidneys for a period or for an extended period of time is what causes chronic prerenal kidney failure. Due to this, kidneys can shrink and lose the ability to function. Chronic prerenal kidney failure. It occurs when there is no enough blood flowing to your kidneys for an extended period of time. Kidneys can shrink and lose the ability to function. Number 4, chronic intrinsic kidney failure. Chronic intrinsic kidney failure. This means that it comes over a period of time. It's not acute. It's not sudden. Chronic intrinsic kidney failure happens when there is long-term damage to the kidneys due to intrinsic kidney disease. Chronic intrinsic kidney failure happens when there is long-term damage to the kidneys due to intrinsic kidney disease. Intrinsic kidney disease develops from direct trauma to the kidney, for example, severe bleeding or lack of oxygen. Let me repeat this again. Chronic intrinsic kidney failure. It happens when there is long-term damage to the kidneys due to intrinsic kidney disease. Intrinsic kidney disease develops from direct trauma to kidneys, for example, bleeding or lack of oxygen. Let's go to number 5. Chronic post-renal kidney failure. Chronic post-renal kidney failure. Long-term blockage of the urinary tract prevents urination. Obviously, when the urinary tract is blocked, will be zero urination or no urination at all. This causes pressure and eventual kidney damage. Chronic post-renal kidney failure. Long-term blockage of the urinary tract prevents urination. This in result causes pressure and eventual kidney damage. Number 6. Acute post-renal kidney failure. The other one was chronic post-renal kidney failure. This is acute post-renal kidney failure. This means that the onset is sudden. This type of kidney failure can occur due to stones or another blockage in the urinary tract. This means there must be a blockage. For example, when you are having kidney stones, there must be a blockage, and this can lead to acute post-renal kidney failure. Because we have said that this type of kidney failure can occur due to stones or another blockage in the urinary system. It doesn't matter where the blockage is, but in most cases, stones can be a common cause, or kidney stones can cause this type of kidney failure. Now we have discussed the 6 types of kidney failure, and we know how they come about. The next question we should ask ourselves: what are the symptoms of kidney failure? Or how will you tell that a person is having kidney failure, be it chronic, be it acute? Or how will you tell that a person is having or suffering from any of the 6 types of kidney failure? Symptoms of kidney failure. Early stage kidney failure is asymptomatic. That means the early stages are not easier to detect because they present no symptoms or they are asymptomatic. Early stage kidney failure is asymptomatic, or it doesn't cause noticeable symptoms, or the symptoms are hard to be noticed. Early stage kidney failure is asymptomatic or doesn't cause noticeable symptoms. According to Centers for Disease Control and Prevention, 90% of people with chronic kidney disease don't know they have it. This is very important. Early stage kidney failure is asymptomatic or it doesn't cause noticeable symptoms. And according to Centers for Disease Control and Prevention, 90% of people with chronic kidney disease don't know they have it. Why? Because the early stages are asymptomatic. As kidney disease progresses, symptoms include the following. As kidney disease progresses, symptoms include the following. Number 1, reduced urine amounts. Reduced urine amount, or you can call it reduced urine output. Number 2, swelling of your legs, ankles, and feet from fluid retention. Remember that kidneys help in eliminating fluids from the body. So when the kidney is malfunctional, or when the kidney is not functioning properly, there will be water retention in the body, and in most cases it causes swelling on the lower limbs, ankles, and feet. Number 3, shortness of breath or breathing problems. Shortness of breath or breathing problems. Number 4, trouble sleeping. Trouble when sleeping. Number 5, muscle cramping. Muscle cramping, especially at night. Number 6, excessive drowsiness or fatigue. Excessive drowsiness or fatigue. Number 7, persistent nausea. Persistent nausea. Number 8, confusion. Confusion. Number 9, chest pain or pressure. Chest pain or pressure. Number 10, seizures. Seizures. And number 11, coma. Let me repeat again the symptoms which will present as kidney disease progresses. Number 1, reduced urine amounts. Number 2, swelling of your legs, ankles, and feet from fluid retention. Number 3, shortness of breath. Number 4, trouble when sleeping. Number 5, muscle cramping, especially at night. Number 6, excessive drowsiness or fatigue. Number 7, persistent nausea. Number 8, confusion. Number 9, chest pain or pressure. Number 10, seizures. And number 11, coma. This marks the end of our video today. So let's continue supporting this channel. Let's share with our brothers and sisters and encourage them to subscribe, share, comment, and I'm sure our education is going to touch so many families out there who are suffering from symptoms of kidney failure, and it will be so easier for each one of them to notice these symptoms earlier before a greater damage happens to their kidneys. Let's have a fantastic day ahead.